Welcome back and thanks so much for joining us. I think this is an interview that everybody should actually listen to. The South African Heart and Stroke Foundation has released statistics which suggest that, listen to this, every day 33 people die from a heart attack and 60 from a stroke. About 80% of these deaths are of individuals under the age of 60. For more on these findings, we're joined by Dr Philippa Peil. She's the Chief Medical Officer at Liberty. Doc, a very good morning to you. Thank you so much for joining us.
Thank you for having me.
Shocking figures. Talk to me about what the prominent causes, I suppose, are.
So with a heart attack and a stroke, the main reason why you get them is because the blood vessels in your heart or your brain actually become blocked. I think it's actually more relevant for your audience to talk about what the risk factors are of developing a heart attack or stroke. Some of the risk factors are things like having raised blood pressure, especially if you are unaware that you actually have raised blood pressure, because I'm sure your audience is aware that there aren't many symptoms for high blood pressure. And a lot of people who know they have high blood pressure, it's uncontrolled in them. Another risk factor for both a heart attack and a stroke is raised cholesterol. Again, most people don't have symptoms, so unless you make an effort because you know there's somebody in your family with raised cholesterol, to go and get that checked out and then treated with either diet or medication, depending what the doctor feels is relevant. Other risk factors for a stroke or a heart attack is physical inactivity. In South Africa, 25% of males and half of women living in South Africa are physically inactive. Exercise is very important for all of us. It helps with improving our immunity, improves mental acuity. It helps lower high blood pressure, raise cholesterol. It also helps us maintain our weight, reduce and maintain weight, because as I'm sure most people are aware, with raised BMI, that's your
Body mass
weight,
index, yeah.
Yes, correct. You have other risk factors of developing things like cancer, stroke, heart attack, sleep apnea, which is problems sleeping, which also increases your risk from heart attack.
Doc, this says to me that these are lifestyle choices that weigh heavily on whether or not you're susceptible to these diseases. What you eat, how active you are, how stressful an environment you're living in. And is this the reason why we're seeing younger and younger people dying of heart attacks and strokes?
Exactly. These are what we call modifiable risk factors. So somebody can actually do something about them, like smoking, quit smoking, alcohol, reduce your alcohol intake. With weight problems, you can reduce your intake, eat the correct food, don't eat rubbish. A lot of us tend to go for fast foods. It's quicker just to go and buy something instead of going to the shop and preparing a salad or something. So yes, these are all things that all of us can do something about and reduce our risk of having these problems in the future.
What do the stats suggest? Is it a greater risk among men or women to develop a stroke or a heart attack?
So with a heart attack, we are aware that it's more a disease in men, but women mustn't think they don't get heart attacks, because they do. And when a woman gets a heart attack, she's more likely to die from it, because women are unaware, so the heart attacks are more serious in them. Strokes tends to be more in women, and if you're going to ask me why it's like that, they actually don't know. They're busy doing studies. They think maybe it's hormonal, maybe it's physiology that causes the problem, but at the moment there is no answer as to why heart attacks are mainly men and strokes are mainly in women.
As frightening as this conversation is, it's also empowering at the same time, because one can learn how to prevent a stroke or a heart attack.
Absolutely.
How exactly do we do that?
Well, I think the most important thing is, as people are aware, hypertension, cholesterol, even diabetes, which is also a risk factor for a stroke or a heart attack, they can go to their doctors and have screening tests done to see if they have any of these risk factors, and therefore to do something about them.
And what will be the emphasis of this year's Heart and Stroke Week?
I think for me it's important to educate people, make them aware of what the problems are. At Liberty we try to do that. When people come in for an insurance medical and they have their cholesterol done or their blood pressure, we'll also do a height and weight for them. We have what we call a little health passport, and we put their cholesterol, BMI, etc. in the health passport. We give them what problems they can have if they are abnormal and what they can actually do to correct those risk factors.
But it's not entirely preventable, is it, completely? Because, I mean, maybe it is, but one hears stories of so-and-so who was an athlete and was so healthy and looked great, but suddenly developed a stroke or a heart attack and died.
Yes, it's not all modifiable risk factors. Some of them are things that we can't do anything about.
Sure.
So if you have a family history, unfortunately none of us can change our family, so you are at increased risk if a family member has had a stroke or heart disease. Also, there's a genetic component to it, besides having somebody in the family. And then the most important risk factor for all of these things is your age. As we get older, we are all more at risk of having these problems.
Doc, thank you so much for that. Having said that, I'm sure, as you've mentioned, there are a number of things that you can do to try and mitigate getting a stroke or a heart attack. So thank you so much for your time.
No
and I must
problem.
just put it out there, as lovely as your hair looks, I know that it is in aid or support of a friend with cancer. So I thought, let me put it out there just in case people are thinking, what a beautiful hairstyle that is. But we do thank you so much for your time, and we wish your friend everything of the best as well.
Thank you so much.
Thank you. Well, let's take a look.